Medtel have an integrated network of centres throughout the UK, offering quick access to private professional medical advice, diagnostic imaging and surgical procedures.
Hello there. Now, if you're watching this, it's probably because you're booked in to have an MRI scan. The good news for you is that Medtel are letting me go along and have a scan. So we're kind of going to go through this together. I'll let you know step by step exactly what happens. Now, personally, I've never had one of these before. I'm a little bit nervous, but also looking forward to seeing what it all entails. So better get going. Don't want to be late for my appointment.
Medtel is best known for its use of open MRI, which combines high-quality imaging with increased patient comfort. The open MRI scan is available to all patients and particularly suited to those who may suffer from anxiety or claustrophobia, as well as larger or frail patients and children, as there are no enclosed tunnels to pass through and patients can comfortably see their surroundings while the scan is in progress.
Hi, my name's Nicola Bond. I'm here for a scan.
Yeah, sure. If you'd just like to fill in these forms and then someone will be with you in just a second.
Okay, lovely. Thank you.
Thank you. Your radiographer's ready.
Lovely. Thank you. Here I am with Dr. Simon Blease. Now, Dr. Blease, you're going to hopefully tell me all about the more technical side of the MRI. So can I just ask you first of all, what exactly is an MRI? What's the difference between that kind of scan and, say, a traditional X-ray?
And the main reason we developed MRI scanners is because we don't use X-rays, which are harmful ionising radiation. So really it's just a giant magnet, and we introduce a radio wave which gives a signal that comes from the human body that we can detect.
So actually there's no radiation, no danger?
No ionising radiation. It's what's called non-ionising. I mean, we sit completely surrounded by radio waves passing through our bodies the whole time. We sit in the magnetic field of the planet. So these are natural phenomena which don't cause us harm, and we've harnessed those and focused them into a machine that can make images.
Wow. Can we talk about the different parts of the body that can be MRI'd, and also, like, does it affect how you go into the machine? Say I'm having my leg done, how would that be different to from having my head done?
All parts of the body are amenable to being scanned, and what we try to do, particularly with the way that Medtel scans patients with the different types of magnets we have, is to introduce the patients into the magnet in the most friendly way possible. So if you're having your foot scanned, you just go in foot first.
So I'm going to admit to you, I'm having a scan later on, and I think I've got two main fears, which you're hopefully going to make me feel better about. The first one is just the whole claustrophobia thing. I'm quite scared of actually going into the machine. I'm also scared, just in case you find anything. I know that sounds silly, but it petrifies me.
To address the first one, I'd say that we've now in this country got 10 years worth of experience of handling patients who feel exactly like you're describing. They're very afraid of what might happen to them. Because we work with predominantly open scanners, our staff get very experienced in dealing with that type of people. So even if we do put them through a conventional scanner, they've got more experience than the regular radiographers might have in terms of handling that kind of fear of going into the scanner. We collect patient satisfaction data and we review it on a regular basis to make sure that we're staying up to our expected performance on that. To address the second point about the concern of what you might find, our general sort of experience on that is that that's a perfectly natural reaction, and that once the scan's been done, patients actually feel relieved that they've undergone it. Yeah. It's a common denominator, I think, for any medical test. There's an anticipation of what the test might find, and then a relief afterwards that at least the test has been done, and whether it's found good or bad, you can then go on to the next stage of your treatment pathway. So we generally try to help people through that.
You've actually made me feel a bit more confident. I'm feeling a bit calmer now about my scan, so thank you. Lovely to meet you.
Thank you very much. Thanks for your time.
On top of this, Medtel offer a full range of diagnostic scanning services, including standard MRI, X-ray, CT and ultrasound.
Well, I've been brought down to where I'm going to be having the scan. I'm just waiting for my radiographer to arrive and let me know what's going to be happening, and been very good, filled out everything on my questionnaire.
Hello Nicola,
Hi,
I'm Tracy.
Nice to meet you.
Hi. Hi, so you've got your forms all filled in?
Yeah, I filled them in.
Scan.
Yeah.
Perfect, let's have a look. Okay, so just checking that we've got your details correct and your surname is spelt correctly and date of birth is 30th of the 9th, 1980?
Yep.
Perfect. And now just from a safety point of view, I just want to check that you've not had any surgery on your chest, your head, your throat or anything like that.
No, only I've had a tooth out, so...
Oh, perfect, okay. And no metal work in the teeth, that's
No.
just recently been put in?
No.
Okay, and you've never broken any bones, had pins or plates put in
No.
that you've forgotten about? Perfect, and no chance of being pregnant at this stage?
No chance.
Right. Okay, now we're just doing a scan of your lower back, so there's no need for us to worry about any injections, but do you have any allergies that I need to know about?
Only to penicillin.
Okay, that's absolutely fine then. What I'm going to get you to do now is just to change for me, and we'll get you into the cubicle. We're also going to offer you some music while we do your scan, okay? There is a playlist for you to have a look at.
Okay.
But before we do any of that, are there any questions that you have about your scan today?
Just kind of what's going to happen during it in the open MRI, what happens?
Okay, well the scanner is quite nice and open. What I normally explain to patients is you can lie like a starfish in it because it is very wide open. You can put your arms to the side, you can also turn your head and look out to the side of the machine. It's not a very long scan. Scanning your lower back only takes about 20 minutes.
Well, I've just had a sneaky peek at the MRI scan and it looks really, really good. It's very open, so I'm not going to feel at all claustrophobic in it. Also, they've said to me that they're going to be doing the scan in segments, which means if I need to, I'm going to be able to scratch my nose in between. The radiographer, really, really friendly and nice. She's going to talk me through it. I'm actually feeling, I'm not feeling bad at all, and I'm just going to go behind the curtain and get my gowns on. Bye-bye.
When being scanned in an open MRI scanner, you will either go into the machine head first or feet first, depending on what part of your body is being scanned. You will be lying on your back for most examinations. If you're having the knee area or lower leg scanned, your head should be free of the scanner. With a hip or lower back scan, you'll be able to turn your head to the side and look out of the scanner.
Okay, what we're seeing here is just the spine in 3 dimensions, so coronally, sagittally and axially, which we use just to plan all the scans that we do.
You will lie on your back with your arms by your side to have your wrist or hand scanned. For a head scan, just the top half of your body will enter the MRI scanner.
Okay, well it's all done. I've had the MRI and I'm going to be honest with you, I was really apprehensive beforehand and now I just can't believe it was a real breeze. I didn't feel closed in, I felt relaxed, I had my headphones on and they actually blocked out most of the noise. It was absolutely fine, and I think one of the reasons I felt apprehensive today is because years ago my best friend had a scan and just before I came she said, oh, you're going to be really nervous, but actually things have obviously changed and coming here has just shown me that it is easy, it's fine, you don't feel stressed at all. So if anyone I know feels ill, needs a scan, I'm going to say come here, definitely recommend this place and you honestly don't need to worry because if I can do it, anyone can.
Hello, Nicola.
Hello.
Here's your CD with your pictures on. Just don't forget to take those with you when you go back to your doctor.
Okay.
And we will send the results as soon as they're ready.
Lovely, thanks for everything.
Thank you, bye-bye.
Bye. Well, there you go. That's the end of my patient journey. It was fine. They made me feel so comfortable. All my worries were put at ease. And what I hope the most is that you've been put at ease as well. If you're coming for a scan, I'm telling you, you've got nothing to worry about. I'm off home right now to see what my insides look like. See you later.
With premium facilities and state-of-the-art technology, supported by a highly qualified team with a passion for service, MedTel offer excellence in patient care and the peace of mind of a fast diagnosis. So it's no surprise that overall, 99% of patients who visit MedTel would recommend them.